For decades, cimetidine was a household name, known primarily for its ability to combat heartburn and acid reflux. This common over-the-counter medication provided relief to millions suffering from these uncomfortable conditions. Little did anyone know that this simple drug held a hidden potential, one that extended far beyond the realm of digestive health. Cimetidine, as research would soon reveal, possessed surprising anti-cancer properties, offering a glimmer of hope in the fight against this devastating disease. The story of Cimetidine's unexpected journey from antacid to potential cancer fighter is a testament to the unpredictable nature of scientific discovery. It highlights how a drug, initially intended for one purpose, can reveal surprising therapeutic benefits in completely different areas. Cimetidine's story began in the 1970s when it was first introduced as a treatment for peptic ulcers, a condition caused by excess stomach acid. Cimetidine worked by blocking a specific type of histamine receptor in the stomach, reducing the production of stomach acid. This breakthrough discovery earned its creators the Nobel Prize in Physiology or Medicine in 1988. At the time, the focus was solely on cimetidine's ability to provide relief from the pain and discomfort of ulcers and heartburn. However, as with many scientific breakthroughs, the story of cimetidine was far from over. In the annals of medical history, there are cases that defy expectations and challenge conventional wisdom. One such case, involving a 73-year-old man diagnosed with advanced lymphoma, would forever change the way we viewed cimetidine. This patient, facing a grim prognosis, had exhausted all standard treatment options. With little hope left, his doctor decided to try something unconventional: cimetidine. The rationale was based on emerging, albeit limited, evidence suggesting that cimetidine might possess some immune-boosting properties. To everyone's astonishment, the patient responded remarkably well to the cimetidine treatment. His tumor, which had been deemed inoperable and resistant to chemotherapy and radiation, began to shrink. The man's overall health improved dramatically, defying the odds, and leaving his medical team both baffled and cautiously optimistic. This unexpected turn of events ignited a spark of curiosity within the medical community. Could cimetidine, a simple antacid, hold the key to unlocking a new weapon in the fight against cancer? The remarkable case of the 73-year-old lymphoma patient spurred further investigation into cimetidine's potential anti-cancer effects. Another compelling case, this time involving an 84-year-old man, added further fuel to the fire. This patient, also diagnosed with advanced lymphoma, had been given a limited life expectancy. Like the previous case, standard treatments had proven ineffective, and hope was dwindling. Inspired by the previous success, doctors decided to administer cimetidine as a last resort. Astonishingly, the 84-year-old man experienced a complete remission of his lymphoma. His cancer, which had spread throughout his body, vanished without a trace. This second case of seemingly miraculous recovery solidified the notion that cimetidine's anti-cancer effects were more than just a fluke. The medical community was now paying close attention, eager to understand the mechanisms behind these unexpected outcomes. The cases of the two elderly lymphoma patients sent shockwaves through the medical community, prompting researchers to delve deeper into the mechanisms by which cimetidine might be exerting its anti-cancer effects. One prevailing theory centered around cimetidine's ability to modulate the immune system, particularly its impact on a specific type of immune cell known as suppressor cells. Suppressor cells, as their name suggests, play a crucial role in suppressing the immune response. While this function is essential for maintaining immune balance and preventing autoimmune reactions, it can be exploited by cancer cells to evade detection and destruction by the immune system. Cancer cells are masters of disguise, often cloaking themselves in a way that makes them appear harmless to the immune system. They can also manipulate suppressor cells, effectively putting the brakes on the immune system's ability to mount an effective attack. This is where cimetidine enters the picture. Research suggests that cimetidine may interfere with the function of suppressor cells, effectively releasing the brakes on the immune system and allowing it to recognize and target cancer cells more effectively.